course, mental health issues do not equate with violence, but everyone who's accused of a crime is entitled to pursue a mental health defense if they choose. Colorado currently has a backlog, hundreds of people long, who need those competency hearings before they can get a trial. The state was sued over this 11 years ago and was making progress. Then things got worse. Anusha Roy looks at why.
There are currently 421 people sitting in jail waiting for a staffed hospital bed for mental health help after being arrested. A judge decided they need treatment to restore competency before their criminal case can move forward. It's feeding into tension between the criminal justice and mental health system.
They don't use the same language or even have the same goals.
Leora Joseph is the director for the Office of Civil and Forensic Mental Health, who wants to be as clear as possible.
No one in the department believes that jails are the best place to receive mental health treatment. Of course not. And that competency restoration is only one form of mental health rehabilitation. It's not as comprehensive as full mental health treatment.
Colorado was sued in 2011. The delays in services were violating constitutional rights. Then things were getting better. Folks were getting treatment faster.
The wait list was down to something like 40 people. And then what happened?
COVID. Like hospitals across the country, they started losing staff to the point they have 84 empty beds at a hospital in Pueblo and 22 in Fort Logan, but not enough nurses and physicians. The number of orders for evaluations also jumped close to 50% since 2018. And now there are hundreds of people waiting in jail.
This is a very painful topic for us. Some of them are waiting over 100 days. Some of them have waited even longer than that.
You're only going to get worse in that context.
Vincent Atchity with Mental Health Colorado said this is one of their top advocacy issues. Atchity said too often the criminal justice system is a person's first touch point for treatment.
A terrible shame for our state and our nation. Colorado is not the only state in this facing a competency backlog situation. These are people whose needs could and should have been met earlier on.
But the reality is, too often that doesn't happen, and there's a serious domino effect.
It makes it harder to house them. It makes it harder to care for them.
It also means that people are being held in jail while their trial hits a pause button. Joseph with the state said that the only way out of this problem is to staff these hospitals. But the big problem is that the pay isn't competitive, off by tens of thousands of dollars. So right now she's trying to get more money to be more competitive. She's hoping in a year and a half to 2 years to make a lot of progress, but said that wait list is not going to be down to zero in that time frame. She said simply that is just not realistic.
So these fines that are being paid, where does that money go? How does that get utilized?
Yeah, so every year the state is paying as much as $12 million, and that money is then going out to different groups that are working on different innovative solutions when it comes to trying to cut down this wait list. And because so many of the people caught in this are also experiencing homelessness, a big focus of that is working on housing solutions.
All right, Anusha, thank you.